Welcome, everyone, to Laser Therapy for Brain Injuries and Neurodegeneration. My name is Dr. Kurt Gehr of Laser Chiropractic in Southern California, and I'm excited to share this information with you guys. I've been using cold laser or laser photobiomodulation in my practice since 2004, and has made a huge difference with my patients. Now, we've got a lot of information to cover in a very short period of time, so first thing I want to do is share with you the outline of what we're going to go over. We're going to understand how cold laser works and what its main mechanism of action is. This is a source of confusion for a lot of people because many people look at it and they say, hey, this just looks like a barcode scanner or a laser leveler. How is it going to do anything? I'm going to explain to you the research studies that show how this actually does affect patients. You're going to understand how they affect many of the pathways involved in brain injuries and neurodegeneration. You're also going to understand how laser can, in fact, penetrate the cranial bones and have a positive effect on the brain, despite the claims of skeptics that it cannot do so. And again, I'm going to show a lot of research studies for you guys. We're going to go kind of quickly. We're going to review some of those studies. I'm going to share with you some case studies from my office, ranging from mild to severe brain injuries, along with some protocols used to get some results. I'm also going to share with you which lasers work best for a traumatic brain injury, autoimmunity, and neurodegeneration, what settings to use, as well as which are contraindicated or are not as effective for the brain. In fact, I'm going to show you a recent study that just came out in December of 2017. There's one particular one you really don't want to use on the brain based on the research. You're going to understand how you can get better and faster results with your functional neurology patients if you do that. If you don't, you can still just use a laser if you don't do functional neurology. I'll show you some of my case studies from before I did functional neurology. So here's my history with using lasers. I started in 2004. I was looking for something to help my patients get better faster, and I found lasers because I was looking at what were some of the pro athletes using. So I found a Dr. Jeff Spencer, who helped me tremendously. He trained me in how to use the lasers. And based on the results that I got with athletes, I actually was invited for a few years to work the Dodgers and Angels fantasy camp. So I got to work with some of these well-known Hall of Famers from the Dodgers and from the Angels. And I started primarily with athletes, again, ranging from concussions to shoulder injuries, knee injuries, fractures, strains, pre and post-op recovery acceleration, and also performance enhancement for sports performance enhancement. I'll show you a particular study that's got some very, very exciting information in there for sports performance later. So that was my main focus from 2004 to 2011. And then I also worked with some gold medal and world record holders. This one gentleman here is Zach Shinnick. He recently set a world record at the Pan Am Games for the Junior Olympics with a world record time. And we used lasers to enhance his performance and help him recover from injuries as well. I was also featured in Dr. Isabella Wentz's worldwide thyroid documentary and New York Times best-selling book, Hashimoto's Protocol, talking about some of the ways I use lasers to help patients who suffer from a lot of the symptoms related to Hashimoto's, to thyroid dysfunction. And that brings me into how everything changed in 2011. So from 2004 to 2011, I was primarily doing a sports practice. 2011, everything changed to help my wife. So what happened was necessity was the mother of invention. She went in for a routine study that had an iodine contrast during a CT scan, and she had a severe autoimmune reaction to it. It had a debilitating effect on her health for months that affected her autonomic nervous system and created something called dysautonomia. She was in and out with the top experts at medical facilities like Harbor UCLA, Loma Linda. Sadly, they had no idea what's happening and no answers for how to help. We felt completely lost, like many patients do when they're suffering from different things relating to brain types of symptoms. With nowhere else to turn, I called my old friend that you guys have probably heard of, Dr. Datis Karajian, and I got her in to see him. Dr. Karajian and I had been friends since we went to chiropractic school together, and he actually did functional medicine on me way back in 1996 when he interpreted some labs that I had. So I knew his level of expertise, and he was the one guy I knew that I could call to try to get some help when no one else could. So Dr. Karajian quickly figured out in a 5-minute conversation on the phone that she had an undiagnosed Hashimoto's reaction, and that the iodine actually triggered a massive autoimmune reaction against the thyroid and brain. He outlined some nutritional and supplemental changes that are necessary, and I took that opportunity to discuss with him if lasers could be useful for her symptoms, especially the neurological ones. I had been seeing some great results with my concussed athletes from football and from wrestling and soccer, and I wanted to talk with him if this could potentially help her. So Dr. Karazian goes home and he starts doing research, and he sends me several research studies that support the use of lasers in autoimmune thyroid and also in brain conditions, and tells me laser the heck out of her brain after reviewing the literature. So it's a pretty exciting moment because things weren't going so well at that time. We felt pretty lost. Now I had some help with Dr. Karazian, and now we were able to create some protocols with using the lasers to try to help the brain. And the standout article that he gave me was from the Journal of Neuroinflammation, titled "Low-Level Laser Therapy Regulates Microglial Function Through SRC-Mediated Signaling Pathways, Implications for Neurodegenerative Diseases." So basically it showed that a laser that was 632 nanometers was able to modulate and calm down the activity of the glial cells in the brain. I got really excited because that was pretty much almost identical to the wavelength of two of my Erconia base station lasers, which are 635 nanometers. So with all that information that Dr. Karajian shared with me and with what I'd learned from the doctors who trained me, like Dr. Jeff Spencer, Dan Murphy, and Jerome Arrucha, I combined all that to create some customized protocols to try to help her. And since 2011, I've continually modified these protocols as I integrated newer research studies from my training from functional medicine courses and functional neurology courses. So here were her laser therapy results. So initially, I treated her on a daily basis, and as her symptoms improved, I decreased it. Treatment was initially done transcranially, both over the occiput and to C1 for 2 minutes, then both parietal lobes for 1 to 2 minutes, and then either over the frontal lobe or through the mouth for 1 to 2 minutes. So I can show you one of the lasers I use here is this one. It's an Erconia laser. It's an older model. They have some newer ones now. You can see it looks like a barcode scanner or a laser leveler. But what I would do is we would go either right here through the mouth, or we go right across the forehead, base of the skull, also the parietal lobes. We do that for a couple of minutes. I'll show you the studies later to show how that actually does get absorption into the brain and has an effect on it. As she improved, I added in some eye movement exercises while laser was applied to the back of her head. One of the cool things was we had before and after lab tests on her to show a drop in the TPO antibodies to an optimal range, and also T3 and T4 into an optimal range. Most amazingly was just a year later, she was able to play tennis with no vital spikes, whereas beforehand, there was no way she could have done that. And again, standard doctors had no answer for how to get her better. We've replicated these results time and again with a lot of patients in our office, and that's why Dr. Wentz featured me in the Thyroid Secret documentary and in her book as well too. So one of the things we do is we'll take a laser with us, because then it's safe. She's going to get motion sickness, which can commonly happen with a lot of Hashimoto's patients or patients with brain issues. We can laser before we leave, and then she doesn't get the motion sickness, which is really nice. So in addition to that, I also lasered near the thyroid, over the liver, the gut, and the adrenals for additional support. The goal was to dampen the antibodies, modulate the glial cells, upregulate nitric oxide and glutathione to help regulate Th1 and Th2 pathways, all while providing improved oxygenation and antioxidant support, along with ATP production and stem cell stimulation, among other photobiomodulatory effects. And again, this is all backed up by research. I'm going to show you those studies coming up here. So before we get into that and how lasers work, one of the things we need to do is we really need to understand the mechanisms that are going on in a brain injury, so we can understand how laser photobiomodulation could dramatically affect them. And that's one of the things we really want to kind of get away from the word cold laser and use the word laser photobiomodulation, because cold is kind of a misnomer. I'll show you that later in the studies. We're trying to photobiomodulate the activity that's going on in the cells. So in this study that came out in August of 2017, this tells us that patients who suffer from moderate to severe traumatic brain injuries frequently suffer from a wide range of cognitive deficits and behavioral changes due to this diffuse axonal injury that can occur. These deficits can include slowed information processing, impaired long-term memory, impaired attention, working memory. You've probably seen this in your patients in your office with auto accidents or with sports injuries. And this can go back many years too. Impaired executive function, social cognition and self-awareness, mental fatigue, personality behavioral changes, such as impulsivity and apathy. So here's the thing at the bottom, this is really important, that a lot of doctors miss. Even mild traumatic brain injuries can raise specific problems, because you're going to have some patients recover within a few weeks or months. There are some patients that are going to have post-concussive syndrome that can last for a long time, especially if you got a patient who's got underlying autoimmunity like Hashimoto's, or if they got diabetes, or they have a lot of inflammation, or they already have poor blood flow. That gives you a poorer outcome there. So when we look at these brain injuries, this is again Dr. Karazian. This is a study that he released called Traumatic Brain Injury and the Effect on the Gut-Brain Axis, or the Brain-Gut Axis, is that one of the overlooked things is the fact that Disruption of the brain-gut axis from traumatic brain injury can lead to a chronic inflammatory problem involving both the brain and the gastrointestinal system, with both neuroregulatory and neuroimmunological loops. So we really need to address these as optimally as we can. When we look at this from the journal Neuron in 2017, September, they're talking about we really need to change the way these brain injuries are treated. They're saying that it affects about 1.7 million people in the US annually, 30% of all injury-related deaths, and approximately $60 billion in costs per year. Many times what's overlooked here is the mechanical effects of the trauma can initiate biochemical cascades, collectively referred to as a secondary injury. So the key is, what they say is that we need to figure out different ways of treating this, because we're not looking at this secondary injury that can develop minutes to months following the mechanical insult. And this can progressively contribute to neurological impairment. I know I've had some patients in my office who got a blow to the head 3 years ago and weren't that bad the first year, but now they're progressively getting worse. So what we're seeing is that some of this damage, the secondary injury, can be mediated by several pathways, including, but not limited to, excitotoxicity caused by excessive amounts of the neurotransmitter glutamate, free radical generation causing damage to proteins and phospholipid membranes of neural cells, and the neuroinflammatory response composed of local and systemic immune activation. So further, they go on to say, really we can skip down here because we don't have a lot of time, saying that rather than just trying to ablate the immune response, which, traditionally we just come in hard with a lot of anti-inflammatories, future studies should focus on therapeutically guiding traumatic brain injury immunity toward a favorable wound healing response that rapidly stabilizes or even restores central nervous system function. So this is one of the cool things about laser, is laser fits with where they're recommending this should go, because it supports and modulates the body's reactions in a positive manner, instead of just universal suppression, which is exactly what the study recommends to be the focus for the new paradigm. Okay, so what effect does laser have on the brain following an impact and this secondary injury we just talked about? Well, this one came from 2014. Low-level laser therapy effectively prevents secondary brain injury induced by immediate early responsive gene X1 deficiency. So basically what they did here is they took mice that had a specific gene deficiency, and they caused the brain injury in them. And what they found is that if they did low-level laser at 4 hours after the injury, it almost completely prevented the secondary brain injury. That's some pretty exciting stuff. So if we can get a laser on these concussed brains pretty quickly, we have the potential to really calm down and prevent that secondary brain injury. You can see that it suppressed the pro-inflammatory cytokine expression like interleukin-1B and interleukin-6, and upregulated TNF-alpha. It also elevated ATP synthesis in the injured brain. So the protective effect of laser may be ascribed to the ATP production and selective modulation of pro-inflammatory mediators. Really exciting stuff. This is the study I mentioned earlier that Dr. Karazian sent to me. So this is where, if you look at the bottom there, again, it's a 632 nanometer laser, so it's a low-powered laser is what they used. They've identified a new and important neuroprotective signaling pathway that consists of regulation of microglial phagocytosis and inflammation under low-level laser treatment. Our research may provide a feasible therapeutic approach to control the progression of neurodegenerative diseases. Really exciting. Now, this is a big study by Dr. Hamblin, who does a lot of research on lasers, and what he found in his studies is that laser therapy can trigger decreased excitotoxicity, decreased edema, decreased inflammation, and decreased cell death. All of this occurs while increasing the formation of new blood vessels, increasing lymphatic drainage, increasing cerebral blood flow and oxygenation, increased neuroprogenitor cells, antioxidants, neurotrophins like brain-derived neurotrophic factor, NGF and NT3, and increased synaptogenesis. And one of the great things is you get all this with no side effects if you use the right kind of a laser. So again, here we're going to ask this question. Many people say, skeptics will say, the laser does not penetrate the skull. Well, yes, a lot of the laser does get absorbed by the skull. However, you look here, he's saying that between 1 to 11.7% penetrates, depending on where you place it. So that's still millions of photons, enough to have an effect. If you look at that laser I showed you earlier, the Zirconia laser, over 1 billion photons are released every second from that laser. So if you're only getting 10% absorption, you still have 100 million photons. If you're getting 1% absorption, you're still having 1 million photons on there. So That's a pretty substantial amount. Now look down here. They found that in these studies, they even tried to cover up the mouse's head. The first one you see there on Parkinson's disease in a mouse model. What they did is they covered the mouse's head in aluminum foil so that no laser was delivered to the cranium, but to the rest of the body. And they found that there still was a highly beneficial effect on neurocognitive behavior with irradiation of the head, but also a statistically significant when the head was shielded. So it works both ways because the laser has some systemic effects. And this other one down below on Alzheimer's disease, they showed improved cognitive capacity and spatial learning as compared to the sham-treated Alzheimer's mice. So they proposed that this mechanism, because they did not treat the skull directly, they treated the tibia, they treated the leg of the mice, that it was by stimulating mesenchymal stem cells in the autologous bone marrow to enhance the capacity of these stem cells to infiltrate the brain and clear the beta amyloid plaques. Really exciting stuff, but you haven't probably heard much about this. So again, we're looking at this, the depth of penetration doesn't really matter since there's a systemic effect with the laser. Don't forget that the blood vessels traveling through the skin will also pick up the photons of energy and deliver it inside the brain as well. I know of one cardiologist who directly does the laser right here over the jugular and carotid artery so that you get this systemic effect. So what's more important to consider when you're looking at these lasers is the wavelength, the frequency, the power, and pulse versus continuous. And we'll get into that a little later. So what happens following the impact? Again, this is important so you can understand, so you can see where the laser is going to have an impact on your patients. First of all, you get this massive glutamate release. So one of the reasons why you should be recommending your patients not eating a lot of foods with glutamate. Immediately after the impact, massive depolarization of the brain cells. Then the ion levels across the membrane are disrupted for 5 to 7 minutes. Glucose uptake increases to pump the ions back. You get the production of free radicals immediately after the impact and ongoing. Now, this is where laser really kind of comes in. You get this free radical damage to DNA and membranes immediately after impact and ongoing. By 30 minutes after the injury, the brain enters a prolonged decrease in glucose uptake and cerebral blood flow. The mitochondria will take up calcium, which causes mitochondrial dysfunction, and that's a big area where laser actually has an impact, is on the mitochondria. This contributes to an energy crisis within hours to days. You get axonal damage from impact causes disruption of axonal transport, swelling, and axonal disconnection within hours to days. So this is where laser therapy can help. The studies show that it can increase the levels of ATP to fuel these protective pumps and support mitochondrial function, while also dampening those free radicals that are damaging the tissues, and also stimulating glutathione production and improving blood flow through the production of eNOS and NNOS with some suppression of INOS, and also modulate the glial cells in a favorable manner. So this is something you guys are probably familiar with. Signs and symptoms of post-concussive syndrome. You get a patient with a small head trauma or a large one. They may have headache, dizziness, vertigo, fatigue, memory problems, trouble concentrating, sleeping problems, insomnia, restlessness, irritability, apathy, depression, anxiety, personality changes, sensitivity to noise and light. This is a great little page that we use as a checkbox for our patients when they're coming in. So I want to show you a case study we did with a 13-year-old athlete with a second impact that devastated her life. So this girl was a young soccer player. She presented in my office. She'd had an auto accident 1 year prior. She had some mild headaches for a few weeks. Saw no real treatment, just went to her pediatrician, and they told her, oh, you'll be fine in a couple of weeks. But several months later, she headed the ball in soccer, and she felt immediate pain in her head. She saw the pediatrician, was diagnosed again with a mild concussion, told just rest, ibuprofen, you'll be fine in a week or two. Well, what happened is the patient actually continued to deteriorate. She became agoraphobic. She didn't want to speak. She was sensitive to touch, to sound, to light. When she came into my office, she really wouldn't verbalize anything. She'd just shake her head quickly, yes or no, wouldn't make direct eye contact. When she saw the pediatrician, they put her on psych meds is what the recommendation was. This poor girl who had been very outgoing and socially active now was having to be homeschooled. She didn't want to talk to any of her friends. She was moody. She used to be happy. So when she came in, I started on a protocol that combined cold laser, some dietary changes and supplements to dampen the inflammation, got her off like the hot Cheetos and the Takis, got her not to meal skip. We put her on a ketogenic diet. We did the laser 2 to 3 times a week for 6 minutes total. The frequencies I used were 4, 9, 33, and 60. That was this laser that I used here. It's 5 milliwatts. Again, we'd go right here, off to the sides and to the back. That was all she could tolerate. We couldn't do any eye movements at all. I couldn't do any other extra stimulation at well because she was so ramped up. As she improved, I could start having her do some eye movements. I could start having her do some cognitive functioning. I could start to kind of stimulate her with an adjuster tool or a percussor to stimulate some of her different neural pathways. But this just shows you that I was able to get that laser on her. So even if you don't know a lot of neural pathways, you can still get that laser on there and calm down some of those events that are occurring in there if you're new to these neurological pathways. So anyway, the results were within a short period of time, within just about 6 weeks. She was able to return to full-time school for the first time in 6 months. And she even attended a dance and went to Magic Mountain and did not have a flare-up. So very, very life-changing for her. So what does photobiomodulation look like? I showed you with my small unit. This is a really cool unit that I like a lot that Erconia makes called the FX635. The reason why I like that one a lot is you see there's 3 different laser heads coming out, and they'll actually rotate so you get better coverage, so more penetration. I'll show you a little video at the end of it actually being done on me. I like this one too because there's preset protocols, so you can just, all the frequencies are pre-programmed. So if you're doing a brain protocol, if you're doing a different injury protocol like a shoulder or like a back or something like that, they're preset. You can put the laser on that. So that's what it looks like. Looks like, everybody says it looks like a barcode scanner or a laser leveler, which yes, it does. But remember, I'm showing you the research that shows everything how this laser actually works. Now, when we look at what research can do, these are just some of the things it can do. I don't have time to read it all to you, but you can see we already talked about helping patients with Alzheimer's, dementia, Parkinson's, modulate immune activity, stimulate brain repair, improve brain performance, sports performance, fracture repair, all kinds of things. If you look down at the bottom, one of the ones I'm really excited about was in that Journal of Biophotonics in December 2016. They actually said that athletes who got laser therapy had got such a performance advantage of bigger muscles, stronger muscles. They were faster. They had better endurance. They recovered from injury more quickly. That they said it was similar to a performance-enhancing drug, and they questioned whether it should be even allowed in international or Olympic competition. Great thing is, again, no side effects. So let's look at this. This is a really, really good, very expansive study. If you're just getting into laser, I recommend you checking out this one. This is called the Hashmi study. The role of low-level laser in neurorehabilitation. And so a lot of people think that laser is new, which is actually not the case. These low-level lasers have been around since really the 1960s when they were first used for wound healing in rats, and they found that it accelerated hair regrowth and stimulated the repair of non-healing skin ulcers. They used a lot in veterinary medicine. And at first it was for wound healing and pain relief, but now we see these uses for stroke, myocardial infarction, degenerative or traumatic brain disorders, because we see that it can have all these different types of effects to cause a tissue to regenerate. Even spinal cord injuries and peripheral nerve regeneration are covered in this study. So I recommend that you check that one out because we don't have time to go over all of it. But what Hashmi talks about is that we're going to see more of these cases as our population continues to age. And a lot of people have a distrust of big pharma. And so it's uncertain what the future is going to hold. So he says that low-level laser therapy has no reported adverse effects if you use the right kind on here. And they believe that's got a high benefit to risk ratio on there. So it should be better appreciated by the medical professionals in the rehab and physical medicine specialties. Unfortunately, a lot of doctors are very biased to just dismiss things that they don't understand. So especially, they said that moreover, the particular benefits of low-level laser therapy to both the central and peripheral nervous system suggest that much wider use of low-level laser therapy could or should be made in cases of both brain diseases and injuries. Really exciting stuff. So what I want to show you here is this was one of my first cases that I had. This is when I didn't know, I hadn't done any training in functional medicine, well, in functional neurology yet. So this patient came in with chronic vertigo for 6 years and nausea. This is Denver. And he had been suffering from this. He had MRIs, CTs, nerve tests. They couldn't figure out where it's coming from. He couldn't take the meds prescribed because he was a long-haul truck driver. So at one point, after just one non-invasive cold laser treatment, transcranially, his vertigo stopped. Now, not everybody does this after one visit. This is actually a little unusual for it to be one visit, but it worked for him. He was able to go several months vertigo-free with treatment. He now comes in only once every couple of years for a follow-up treatment. He's still good. He doesn't have to take his meds. So that shows that this was in the days when all I did was get the laser on his brain just to dampen the inflammation and try to stimulate some repair, and it worked for him. So here's my protocol for him. Again, really easily. I took the laser, placed it over the occipital lobe for 2 minutes, each parietal lobe for 2 minutes, then the frontal lobe. Or if you really want to get some good absorption, because of all the blood vessels, you go through the mouth and the nasal cavity here. Settings were 4, 9, 33, and 60 hertz, 5 milliwatts, 635 nanometers. He came in nauseous and with vertigo and left symptom-free. So let's look at some more things. Laser stimulating tissue repair and enhancing function. This is cool. Brand new study here. 2018. Photobiomodulation therapy promotes neurogenesis by improving post-stroke local microenvironment and stimulating neuroprogenitor cells. So this one showed that in this study that when they caused a stroke, that photobiomodulation attenuated the behavioral deficits and infarct volume. It enhanced neurogenesis and synaptogenesis. It caused a robust suppression of reactive gliosis and the production of pro-inflammatory cytokines. What we saw was a release of anti-inflammatory cytokines. Cytochrome C oxidase activity and ATP production were elevated in the damaged areas, really, really important for recovery. What they also found that it switched the M1 microglial phenotype to an anti-inflammatory M2 phenotype. So the big thing is it promoted neurogenesis after ischemic stroke. And I've seen this in my office and other doctors who've worked with patients with stroke using low-level laser therapy. Really, really exciting. Again, you can go really simple or you can get really complex with this. Let me give you some more background here. This is not specific to the brain, but this is one from 2000. So again, we're looking at 18 years ago, a study that came out. Basically what this showed is that when using low-level laser, that wound healing was accelerated 25 to 35% faster in the group treated with low-level laser. And no side effects as well, too. Here's the one I talked about before, Journal of Biophotonics, photobiomodulation in human sports performance gives them an advantage. I treat a lot of pro athletes, Division I college athletes, some of the top athletes in the nation. So we've seen this result with these patients enhancing their sports performance and no side effects. Now, this one is probably the biggest case of all. It was the most surprising case to me because this particular patient had a TBI with permanent impairments from 30 years later. So this is Brian, and he was injured when he was just 6 months old by a Los Angeles city employee who was drunk and high. He drove his city car right through their living room and hit him while he was on the couch, injuring him and his sister. He was left with partial paralysis of the left side, almost no eye movement to the left. He'd bump into things when he'd walked, would drift to the left while walking, and was left developmentally around 10 years old at max. So in addition, he couldn't make decisions for himself and could not plan into the future. He had no concept of sarcasm and was not quick with joking. His family was mostly interested in trying to help with chronic gut issues since the injury. So that's what we were starting just to work on. I didn't think we were going to have really any changes at all. What we did on him was we combined functional medicine with the laser. So I ran labs on him, tested him to see what foods he reacted to. We removed those. We balanced out some blood sugar levels, some inflammation. He was reacted to gluten and casein, so we removed that. We did some specific supplemental protocols with him. And in the office, I used a 635 nanometer laser from Merconia, 7.5 milliwatts, transcranially while I had the patient perform pursuits and head movements with the eyes fixed on a target. I also lasered him over the nerve roots in the neck and cervical spine while I assisted him with arm movements, just to try to get some stimulation there. I also stimulated some vibratory pathways with a percussor and mechanoreceptors with an adjuster tool over the spine while I had the laser on the brain. Because if we have more input firing up to the brain while we're lasering it, it seems like we get a better result on there. So here are his results. Within 4 weeks, Brian began to be able to fully move his eyes to the left for the first time since the injury 30 years ago. It surprised the heck out of me. I'm trying to have him follow my eyes. Beforehand, he would have no drift to the left. All of a sudden, he fully moved me out and followed the finger completely out there. After we've continued working on this, now he can even hold his gaze. Beforehand, it would be there for a second and pop back to the center. Now he can actually hold his gaze there. So we know that brain's firing better. It was totally impossible before. Beforehand, he could not look up. Now he can look up. He could not do that previously. He now can walk without a drift to the left, does not run into walls or people when walking. His arm strength on the formerly paralyzed left arm has improved to where he can now hold it up to 45 degrees of flexion on his own without using the other arm for help. He used to have to pick it up like this. And I got to go back on saying on his injury, he has a plate in his head. So that's how severe that injury was as a baby. For a while, he was blind. And so he had some regeneration, but no changes in 30 years. But cognitively, these are the most startling results. This is what his family has really shared with me. This is a testimonial, I said. They said they began laser therapy 2 years ago with me and only took a couple of sessions to begin seeing the benefits of the lasers. He'd always been mild-mannered, polite, and what they'd call a yes man. Never argued with the choices the family made for him and always agreed with whatever the family was doing. But about 4 to 5 sessions in laser treatment, that all began to change. So Brian started to ask questions. He gave suggestions on places he wanted to go or meals he wanted to have. He was always been capable of holding conversations, but now his thought pattern, they said, was changing. Ideas were getting more complex, and he came up with solutions to some of the challenges he'd had in the past all on his own. He also began using his left arm. It's still paralyzed, and we know that it won't change, but he uses it in ways that he never did before, like to open a snack bag or juice bottles. He's making connections and seeing patterns in everyday life that he didn't before, and they can attribute that to laser therapy and dietary changes that I had suggested, and they implemented. They're continuing treatment as long as possible to help maintain and improve his cognitive development. And one of the funny things they told me is we've kind of created a monster, because they said he used to be a yes man, and now he says no a lot because he actually has a mind of his own saying, no, this is not what I want to do. I want to do something else. This was an update too. His birthday was in October, and normally he has no idea when his birthday is, and he doesn't care what happens for his party, but this year they said it was very different. He knew his birthday was coming once September was there, and he specifically asked his mom when it was going to be, which he never did before. He then told her specifically that for his birthday, he needed a taco caterer. They needed to call a magician they had for his birthday in the past. And he gave her a list of who she needed to invite, and specifically that she had to ask a specific birthday to bring his best friend early, since she was his only way to get to the party. They said he never could have had that kind of complex thought before using the laser. When they did not want to get him the magician due to the cost, and they recommended he just watch the old video from his past birthday, he had a whole argument to explain how it was different experiencing in live versus on video, which again, they said he never would have been able to comprehend before the laser. Again, 30-year-old injury. So what I want you to understand with this, if you're new to lasers, is that there are a lot of possibilities. I'm surprised every day in my office of what we're able to accomplish. There's new studies coming out all the time. We're going to get here on if you're thinking about getting into lasers, what you need to look for, because there's an important question. Are all lasers equal? And when it comes to doing brain work, really they aren't. You're going to see there's a lot of people that really promote more power being better, that you got to use a high-powered class 4 laser. But the bulk of the research is really on the lower class 2 and class 3 lasers. I'm going to show you this particular one here, just from May of 2017 in the Journal of Athletic Training. That phototherapy for improvement of performance and exercise recovery, they compared 3 commercially available devices. So basically, they compared a high-powered class 4 device. And many of those manufacturers try to claim that it does the same thing as a low-powered laser, but even better. But there's not that much research. This particular one says research with these high-powered lasers is lacking. The results they found is that the best muscle results were with the low-powered laser group compared to the high-powered laser groups. The lower-powered pulsed ones, they found that pulse was better, demonstrated less muscle soreness than all groups. They found that creatine kinase activity was decreased in low-powered pulse laser compared with the high-powered one. They also found that the high-powered one did not demonstrate any positive effects on maximum voluntary contraction, creatine kinase activity, or muscle soreness, and they actually said it increased creatine kinase, which suggested it could be muscle damage there. So their conclusion was that a low-powered pulse laser demonstrated better results than either low-powered continuous or high-powered continuous laser in all the outcome measures. So that's one thing. It takes it a whole step further, though. The lasers I've been talking with you about, like the ones I use from Erconia, are a class 2 laser. This study, although it says low-level laser therapy, it's a misnomer. They really should have said high-powered laser therapy, because this was a class 4 device that they used in here, or multiple class 4 devices. So what they found is it actually stimulated cancer cell growth. So definitely you have to exercise extreme caution with using those lasers, especially over the brain, because they found that it could activate precancerous cells or increase existing cancerous tissue. So here's the deal. They used lasers that were 500 milliwatts, 1 watt, 2 watts, and 3 watts. Again, you see my note in yellow there. That's the misnomer. These are really not low-powered lasers. Those are class 4 high-powered lasers. What they found is that proliferation rates increased as the number of applications increased when compared to the controls, especially in the cases where laser was applied 2 or 3 times more frequently with these higher powered class 4 lasers. So the conclusion is that these high powered class 4 lasers can increase cancer cell proliferation depending on the power output and the level of the laser and the number of applications. This is a brand new study from November of 2017. So a lot of doctors don't know about this, but if you're going to use laser, you must know this so you can make the appropriate selection for your patient to use a safe laser in an appropriate manner. Okay. Let's go to the next thing. So how do you determine? So again, when we're looking at lasers, a lot of people are like the 1990 sitcom Tim the Toolman Taylor. They think more power is better. And even on that show, think about how much trouble did he get into when he was trying to get more power to everything. He ended up blowing things up. And you saw from that previous study that you can blow tissues up. You can really stimulate some negative effects in there. And what Hamblin and De Freitas found is that you can have one effect at a low level exposure and the exact opposite at high doses of the same milliwatt nanometers. And there are actually studies you can look at on cancer and low level lasers that are the opposite of what we just saw there. But I just wanted to give you that warning. We don't have enough time to get into all of those. So again, here, this is what Hamlin talked about in Shining the Light on the Head, Photbiomodulation for Brain Disorders, is you have to understand the concept of hormesis and also the Arndt-Schultz curve. And what this is that a low dose of light is beneficial. But if you raise the dose, it produces progressively less benefit until eventually a damaging effect can be produced at a very high light. So in that context, more does not mean more. This goes back to what we saw with the patient Brian and the other ones. You may be thinking, wow, if I only did 6 minutes or 8 minutes of therapy, what if I did an hour on that patient? Would it be better? And we can see from the studies, no, that's not the case. You got to get the right dosage in there. So what I want to share with you towards the end of this presentation here is where laser research is going. So there's actually studies on lasers with Parkinson's, Alzheimer's, autism, and more. So this was a study done by Erconia on Parkinson's. And what they found is that they had statistically significant decreases in self-reported presentations were identified for 4 of the 6 measured outcomes. So they had improvements in gait, freezing, cognitive function, and difficulty with speech. That was with the Erconia PL2000. This is another study released from the Journal of Neuroscience in 2010. So it's not brand new, but a lot of people haven't heard of it. Low energy laser light at 632.8 nanometers suppresses amyloid beta peptide induced oxidative and inflammatory responses in astrocytes. So when we look at Alzheimer's disease, we can see that when these rats were exposed to this type of laser, it suppressed the amyloid beta induced superoxide production and the expressions of interleukin 1 beta, inducible nitric oxide in primary astrocytes. So they demonstrated that it's capable of making some cellular changes that can have a big impact on patients who are suffering from Alzheimer's disease. Now, this next one is really exciting. I was hoping I could have shared these results with you guys, but they have not gotten the study released yet. But so this is the soon-to-be-released study on laser photobiomodulation and autism by Erconia Medical. So this is just shows that the trial has been completed. They're finalizing all of the information to send it out to the FDA. They had some really positive results. You see the study followed children aged 5 to 17 years. I can say in my office, I've worked with some patients who have autism, and many times we can see some changes even during that session while we're working on them. I see some patients start to calm down. Okay. So let's wrap this up with talking about what some of the treatment protocols are. So with the brain protocol, I'm not saying that a laser is a cure-all for everything. You definitely want to work with everything else that you know, but it can enhance everything that you're doing. And if you don't have functional neurology knowledge, this is a great place to start. That's how I started. It really is kind of like a cheat sheet to really enhance your learning curve. One of the things I'd recommend if you really want to get up to speed on that is go to functionalneurologyseminars.com. That's my friend, Dr. Datis Karajian and Dr. Brock. They created some fantastic information, great questionnaires on there. You can get some ideas of how to work with this on there. What a lot of times I like to do is have a family member in the room with the patient, is they're often more aware of the changes that the patient may not be aware of. So you want to pay attention to their ability to concentrate, if they're wearing sunglasses or complain about the brightness of the lights, if they fatigue during the exam or filling out paperwork. Notice the speed they answer your questions and if they can stay on topic. Have them perform some tests, some functional tests for cerebellar function, like Romberg's with the eyes closed and open, rapid alternating hand movements, finger to nose, heel to shin, tongue, etc. Whatever you normally do to assess these patients. And you can challenge them more if nothing pops up with that. What I like to do then is also run labs if you can, like I did on patient Brian, so we could see, is there a thyroid problem? We know that TPO antibodies negatively impact the cerebellum, but through some of the studies I shared in Dr. Isabella Wentz's Thyroid Secret documentary, there are studies that show that laser can dampen TPO antibodies, so that could potentially help the cerebellum. So that's something you can also track to see your progress and try to spare the cerebellum. I look at inflammatory markers like C-reactive protein, ESR, uric acid, etc., glucose markers, anemia markers, magnesium status, vitamin D, all the normal stuff you're going to run. I also like to test for food reaction panels, but let's be honest, many of the patients don't do all that, so a lot of times we just jump in and do laser, and this is my starting point with them. Here's my basic brain protocol. Again, I take the laser, I laser the back of the head, just where the head meets the top of the neck for 1 to 2 minutes with these basic frequencies of 4, 9, 33, and 60. For each spot of application, I hold the laser about 2 inches from the skin, same thing right here, just to get that illuminated. I laser the frontal lobe or directly in through the mouth and the sinus passages for another 2 minutes, and then over each parietal lobe. While the laser is being applied, you can have them do some exercises, whatever they have difficult, you can have them do. If they got difficulty swallowing, have them swallow some water while you're lasering them. If they have difficulty with balance, have them try to balance. If they have difficulty with memory, have them try to recall what they did yesterday, etc. You should get the picture with that. Alternatively, if you have that FX unit, which you see there at the bottom there, if you've got that unit, that's the easiest one, because the one you saw me with the 3 lasers, you just stick the patient over there, hit the button, and then you can do all the rehab exercises with them while they're under there, and you don't have to hold it on them. So again, basic premise of doing the brain injury treatment, whatever they have trouble doing, have them do it while you laser them up to their tolerance. That will increase the effectiveness of any existing functional neurology protocols. So again, everything I just went through, bad math, laser transcranially while they count backwards from 100 by 5s or 2s or 7s. If they got problems with word recall, I have them try to say a word that starts with each letter of the alphabet while I'm lasering them up to their tolerance. Okay. So again, here's a video example of what it looks like. This is the FX in use. So you can see it's really simple. I just sit down under it. It's a little off center on me because I had to apply it to myself while holding the phone here. But you can see we got 3 different laser diodes that are going on here, 635 nanometers. And they actually rotate to get a greater coverage. I do wear the protective glasses on there just to protect the eyes. This is a class 2 device, so it's not damaging, even if you do kind of flash the eye there. Okay, let's look at the next one. Alternatively, we'll do it in this manner too. We'll have the patient lie down and go through the open mouth like I mentioned before. Now, some of you who may be familiar with laser may have been taught by some laser companies that you should never laser over the thyroid. There are some contraindications with high-powered lasers, definitely the class 4 ones. However, there was a study by, I believe it was Hoffling et al., called the Brazil study, that actually showed that the laser can have some benefits for thyroid patients. So, again, I was setting myself up here. It's not the optimal setup. If you're concerned about that, normally I would have this laser that's above the mouth down closer in there so it's really shining more in the mouth. If you're concerned, you can always cover up the thyroid with extra clothing to kind of block the absorption there. So again, which laser to lose? I like the Zirconia lasers. They just do a ton of research. I've used them for 14 years, so I am definitely biased with that, and I do teach courses on how to use their lasers. They're easy to use, pre-programmed, lots of research. They got the research coming out on the autism study. They've got ones on Parkinson's. They've got another one coming up on Alzheimer's that they're working on. So great research when you're dealing with the brain. That's a great unit. This is a unit I have in my office. I got the older version, but this one's great. There are 3 lasers that come with it. It's called the base station. I like it because if you see there on the right side, that one that has the bluish kind of color on it, and all the other 2 are red, that one's called the EVRL, and it's got some violet settings. It's a 405 nanometer laser combined with the red line laser as well. So 405 nanometers, you can also do some things with modulating the immune system to help with infections and other things in that matter. So it gives you more versatility. I love that one. I've been using that one for the last 10 years. So that brings us to the close of this. I know it's a ton of information. If you want more information, I've created a few resources, and we've got some gifts that are going to be given to you as well, too. Some little bonus videos you can watch and some other topics. I have several other topics on sports injuries, on laser for non-surgical fat loss, on laser for thyroid support, and also I have a more detailed one on concussions as well, and also peripheral neuropathy, We got one coming up on the shoulder. So we're going to give you some gifts on there for that. You can go to my Facebook page, Cold Laser Forum. On that one, I have announcements of free webinars and laser therapy topics. My blog site, drkirkgear.com, and also my thyroid page, facebook.com, thyroid info. I've got around 10,000 followers on there. This one mostly focuses on thyroid, brain, and gluten-related issues. So I want to thank you guys for your attention. If you got any questions, feel free to message me through any of those sites on there. And I hope that you found this very helpful for you and your patients.